Hello and welcome. Today we're delving into the complexities of malabsorption syndromes, a group of disorders where the small intestine struggles to properly absorb nutrients from the food we eat. This can lead to a cascade of health issues, so understanding what causes malabsorption, how it affects the body, and what we can do about it is crucial. So, what causes these malabsorption syndromes? The causes are incredibly varied. Some are inherited, like cystic fibrosis, which affects the pancreas and hinders enzyme production necessary for digestion. Others are acquired, meaning they develop later in life. These can include infections like giardiasis, which damages the intestinal lining, diseases like Crohn's disease and celiac disease that cause inflammation and structural changes in the gut, or even surgical procedures that remove parts of the small intestine, reducing the surface area available for absorption. Certain medications, like some antibiotics, can also disrupt the delicate balance of gut bacteria and contribute to malabsorption. Essentially, anything that interferes with the normal process of digestion and absorption can potentially lead to malabsorption. Let's explore the pathophysiology of malabsorption. Normally, the small intestine is a nutrient-absorbing powerhouse. Its lining is covered in tiny, finger-like projections called villi, which dramatically increase the surface area for absorption. Malabsorption disrupts this process at various stages. It might involve impaired digestion, where the breakdown of food into smaller, absorbable molecules is compromised. This could be due to a lack of digestive enzymes, like those produced by the pancreas. It can also involve impaired absorption, where the intestinal cells themselves are damaged or dysfunctional, preventing them from taking up these nutrients. Finally, there can be issues with nutrient transport from the intestinal cells into the bloodstream. Regardless of the specific mechanism, the end result is the same: nutrients that should be nourishing the body pass through unabsorbed, leading to deficiencies. Understanding the epidemiology of malabsorption is tricky because it encompasses many different underlying conditions. The prevalence varies greatly depending on the specific cause. For example, celiac disease affects around 1% of the population in many Western countries, whereas lactose intolerance affects a much larger percentage, varying by ethnicity. Other causes, such as tropical sprue, are geographically restricted. Malabsorption can affect people of all ages, but certain conditions are more common in specific age groups. For instance, cystic fibrosis is diagnosed in infancy or early childhood, while other causes might manifest later in life. It's important to note that many cases of malabsorption may go undiagnosed, as the symptoms can be subtle or attributed to other conditions. The signs and symptoms of malabsorption can be quite diverse, reflecting the wide range of nutrients that might be poorly absorbed. Common symptoms include chronic diarrhea, steatorrhea, which is pale, bulky, and full-smelling stools due to undigested fat, abdominal bloating, gas, and cramping. Unintentional weight loss is also a frequent symptom. Beyond these gastrointestinal issues, nutrient deficiencies can lead to a host of other problems. Iron deficiency can cause anemia and fatigue. Vitamin D deficiency can weaken bones and increase the risk of fractures. Vitamin B12 deficiency can lead to neurological problems. Edema or swelling can occur due to protein malabsorption. Children with malabsorption may experience growth retardation. Because the symptoms are varied and can mimic other conditions, proper diagnosis is critical. Diagnosing malabsorption often involves a multi-pronged approach. The initial step is usually a thorough medical history and physical examination. Stool tests are commonly performed to check for fat malabsorption and the presence of parasites or bacteria. Blood tests can help identify nutrient deficiencies and assess overall health. Further investigations may include imaging studies like X-rays or CT scans to look for structural abnormalities in the digestive tract. Endoscopy, where a small camera is inserted into the digestive system, allows for direct visualization of the intestinal lining and the possibility of taking biopsies for microscopic examination. Specific tests, such as the Decoder absorption test, can assess the absorptive capacity of the small intestine. A lactose tolerance test can diagnose lactose intolerance. The specific tests ordered will depend on the suspected underlying cause. Malabsorption syndromes can be broadly classified based on the underlying cause or the specific nutrients that are poorly absorbed. We can categorize it as follows: enzyme deficiencies, such as lactose deficiency; diseases affecting the small intestine, such as celiac disease, Crohn's disease, and Whipple's disease; post-surgical malabsorption, often due to short bowel syndrome, resulting from surgical resection of significant portions of the small intestine; and infectious causes like giardiasis. It's important to recognize these distinct categories, as they influence the specific approach to treatment and management. Treatment and management of malabsorption focuses on addressing the underlying cause and correcting any nutrient deficiencies. If the cause is an infection, antibiotic-parasitic medications are prescribed. For conditions like celiac disease, a strict gluten-free diet is essential. Enzyme deficiencies, such as lactose intolerance, are managed by avoiding the offending food or using enzyme supplements. In some cases, corticosteroids or other immunosuppressant medications may be used to reduce inflammation in the digestive tract. Nutrient deficiencies are typically addressed with oral supplements, or in severe cases, intravenous nutrition. Dietary modifications, such as a low-fat diet or the elimination of certain foods, may also be recommended. In cases of short bowel syndrome, specialized nutritional support, including parenteral nutrition intravenous feeding, may be necessary. Preventing malabsorption is not always possible, especially when the underlying cause is genetic or related to a pre-existing condition. However, there are steps that can be taken to reduce the risk. Practicing good hygiene, such as frequent hand washing, can help prevent infections that can damage the intestinal lining. Avoiding unnecessary antibiotic use can help maintain a healthy gut microbiome. For individuals with known risk factors, such as a family history of celiac disease, early screening and dietary modifications can be beneficial. If you have symptoms suggestive of malabsorption, seeking prompt medical attention is crucial for early diagnosis and treatment, which can prevent long-term complications. The prognosis for malabsorption syndromes varies depending on the underlying cause and the effectiveness of treatment. In many cases, malabsorption can be successfully managed with dietary changes, medication, and nutritional support. Early diagnosis and treatment generally lead to better outcomes. However, some conditions, such as short bowel syndrome, can pose significant challenges and may require long-term management. Recent research is focused on developing new therapies to improve nutrient absorption, reduce inflammation in the gut, and restore a healthy gut microbiome. For example, studies are investigating the use of probiotics and fecal microbiota transplantation to improve gut health in individuals with malabsorption. Gene therapies are also being explored for some genetic causes of malabsorption, such as cystic fibrosis. As our understanding of the complex interplay between the gut microbiome, diet, and the immune system grows, we can expect to see even more innovative approaches to treating and preventing malabsorption syndromes in the future.